Hello everyone. Welcome to the course on Health Humanities, Indian and Western Medical Knowledge Traditions. This is lecture number 18 on epistemic shifts in health, illness and medicine. In this lecture, I will talk about the transformation of medical space, both hospitals as well as clinical space where teaching and medical treatments were carried on. I will talk about the new understandings of body, illness, disease, and medicine, and how it has led to the shift in perception of illness. I will talk about the role of medicine and how it has been part of power and knowledge, and then how medicine sets some kind of normative order, how medicine has been part of normalcy, and it segregates the people who are considered to be abnormal, unfit. So in this way, I will talk about certain kind of changes, certain kind of shifts which have occurred in the idea of body, illness, disease, and medical practice. While talking about the transformation of medical space, one has to think about the evolution of medical hospitals and how hospitals have evolved. When we look at the origin of hospitals, they began from charitable institutions, and then they have been transformed into scientific centers, where a rational, clinical, and observational study is done, and then the same is used for treating and curing disease. So there is a kind of spatial recognition which is necessary for better observation and diagnosis. Medical knowledge is tied to the visibility of the body, where the body has been exposed, categorized, studied, critiqued, defined, and controlled for various purposes. So medical knowledge is not just about like looking at the disease and illness in the body, but also exposing the body, making it visible, making it something to be controlled. And in this way, the medical knowledge has on one side led to the treatment and cure of the body, but on the other side it has led to the emergence of a new power that has been used to dominate and control the body. Further, clinical spaces facilitated standardized notions of care and reinforced the institutional authority over the patient's body, which means that when there is like a kind of standard form of care, or there is a kind of reinforcement of institutional authority, then the body of patient becomes secondary. It is the doctors who will suggest what like one needs, and it's not like what the persons want or what the person actually has to say about himself. So the transformation of medical spaces have provided more power to the hospitals, to the clinics, to the institutional authorities, and it has given the secondary spaces to the patients, the people who are ill. And this new approach to body, illness and disease and medicine has led to a new understanding of clinics. Foucault says that the clinic, constantly praised for its empiricism, the modesty of its attention, and the care with which it silently lets things surface to the observing medical gaze without disturbing them with discourse, owes its real importance to the fact that it is a recognition in depth, not only of medical discourse, but of the very possibility of a discourse about disease. One has to really rethink this entire passage, re-examine that though like clinic, teaching hospitals and curing hospitals are often praised for their empirical observational aspect of health and disease. They have enough modesty in terms of their attention, but silently, secretly, they have led to something which is very, very different, and that is about the possibility of creating new discourses about disease. So, how a disease has been perceived, how a disease has become known to the society, how a certain ideas, certain notions about disease become legitimate, circulated in the society. Those were created, constructed, manufactured, narrativized, and by the clinic. So clinic has not just the purpose, the task of curing, treating. It has a larger task of creating narrative, creating discourse about disease, and then leading to some kind of new understanding, new perception, new observation about disease. So disease is something which is the person is having, but at the same time, it is also something which is created by discourse. So disease is something that is part of one's bodily disorder, as well as some kind of knowledge produced by the clinic. Illness has three larger domains for study. Illness can be studied from three dominant perspectives. Disease can be studied from three dominant perspectives. Number one, functionalism. Number two, the political economy. And third, the social constructionism. What is functionalism? Functionalism says that illness is an unnatural state of the human body, which is causing both physical as well as social dysfunction. Illness is something which is not acceptable, which is unnatural. So they like something natural, something pre-given, something standard, something normal, something normative, and any kind of disturbance is unnatural, unacceptable by the body, by the society, and it will further cause not just some kind of physical disturbance in the body, it will also cause social dysfunction, because the person will be then identified, defined, and isolated. For instance, like a person who is having cancer, leprosy, AIDS, or any other kind of disease, and then the person will be segregated in the society. People may not accept him. The person may be excluded. When it comes in terms of some kind of social functions, let us say like a marriage or some other kind of function, they may not invite him. In this way, illness has become the part of social dysfunction. So illness is not just a problem for the body, physical body. It is also a problem for the social body, where the person gets excluded, marginalized, or described negatively. So the functionalist approach takes the body as something which has become unnatural because of illness, and then it talks about how the ill person has been defined, categorized, excluded, and segregated. The second approach is the political economy, which is not just focusing upon physical well-being, it is also talks about the emotional well-being. But apart from that, so political economy considers physical and emotional well-being, but at the same time it talks about how one person contributes to the development of economy. It is about the access to and control over the basic material and non-material resources that sustain and promote life at a high level of satisfaction. What is this high level of satisfaction? This high level of satisfaction can be of the individual, of the state, of the community, of the larger organizations, and they have certain kind of expectations, and when those expectations are not fulfilled, and then they are seen as lacking in terms of political economy. And the persons like who are old age, the persons who are of old age, are those who are ill, who are disabled. They are marginalized in the society. They are marginalized because they are seen in a traditional conventional sense that they do not contribute in terms of what so-called normal abled person contribute. So this leads to the what you call categorization and organization of human beings between the abled and normal and disabled and those who are not like fit. And further, the political economy has become an instrument of control, and which means medicine has also become an institution of control. So the people like who are marginalized, who are ill, who are aged, who are disabled, who are like having physically weak body, then they are controlled. They are not having access to certain form of social systems, certain form of economic systems, certain economic jobs and practices. They are segregated. They are not given those opportunities. And in this way, political economy sets a normative order and punishes the deviant in the name of maintaining social order. So political economy of medicine says that the people like who are ill, and then they should be actually categorized, and then it punishes them by segregating, by depriving them certain opportunities. It says that it is necessary to maintain some kind of social order. The third approach, which is social constructionism, this is also a site of control. Like when illness has become part of illness has been examined from the point of view of social constructionism. For example, based upon gender, based upon one's social background, and then they are not having the adequate access to the medical resources, and then they get they get limited space in the society, in the economic institutions. So medicine also acts as a form of control. It controls the people from their various roles in the society. This shift in the perception of illness has a very like a long history, and during modern times, which means 18th and 19th century, disease is no longer seen as a divine or a moral event, that someone is having disease because of their past actions, because of their wrong actions, or maybe their sinful actions. Rather, it has been seen in terms of diagnosis and gaze and clinical results. In this way, illness has been linked to anatomical and physiological abnormalities. So the idea of illness, which was earlier seen as a kind of divine punishment, is now seen as a kind of anatomical bodily disturbance, physiological abnormality, and which can be cured through different means, through operations, through medicines. Further, medical language reshapes patients' understanding of their bodies, because medical language will determine, it will actually shape, it will define and describe the body in a particular way. Like what is good body, what is bad body, what is able body, what is disabled body, what is acceptable, what is non-acceptable, which is like a fit body, which is diseased body. So it has a lot of like definitions that medical language attributes to the body of human beings. Further, the focus shifts from holistic to the mechanistic view. Patients become objects of clinical scrutiny. They get scrutinized, they get examined, and certain knowledge is produced about them. The clinic unites theory and practice and uses the latter to modify the former, thereby combining a new kind of teaching. So clinic unites like what they do in terms of their practice, I mean in terms of curing the person who is having disease, and what they actually teach. So they, like modern clinic, modern medicines unite the theory and practice. So the teaching of, they unite the teaching of medical ideas and medical practices. Then use medical practices to modify their medical teachings, and then produce a new kind of knowledge about teaching. The clinic has become the primary instrument of medical instruction and the advancement of medical knowledge. So in the modern times, the medical knowledge and medical institutions have been produced and circulated through clinic through their practices, through their observations and their studies. There is like what you call classifications of disease. There are new statistics of disease. So illness have been classified based upon symptoms and outcomes. There are like different methods which are used to classify them and they categorize them. So there is like a kind of statistical methods, clinical charts, which are used to like classify and diagnose the disease. And then this leads to the categorization and study of larger what you call populations. And in this way, disease became a population-based phenomena, not the individual bodily issue problems. It increased the focus of probability and risk in diagnosis, which has led to new kind of study, new kind of control and domination. Let us think about like how medicine produces power and knowledge. And as I have discussed earlier, medical knowledge produces new kind of knowledge about the person, about the body. And this new knowledge about the person and his body are maintained by the institutions. Which other way I can say that medical knowledge are produced and maintained by the institutions. They produce certain knowledge and then control the way the person is getting diagnosed. The doctors gained authority through their specialized knowledge and began to actually look at the body of the patient and categorize them accordingly. The patient has become the subject of the evaluation of experts. The patient has become the subject of the classification by the experts. And so this like classification by the experts has led to some kind of power relations, which are also embedded in diagnostic practices. And in this way, medical discourse regulates what counts as health and illness. So health and illness are not seen and examined in neutral way, but they are regulated and controlled by medical discourses. Medicine sets some kind of normative order. So medicine is not, the purpose of medicine is not to cure the person only. The purpose of medicine is not to just like treat the person who is ill and sick. Medicine has a larger function, larger power. And this power is to set a normative world order. It is very like critical aspect of medicine that medicine has multiple roles apart from treating and curing the person. Michel Foucault in The Birth of Clinic says, medicine must no longer be confined to the body of techniques for curing ills and of the knowledge that they require. It will also embrace a knowledge of healthy man, that is, a study of non-sick man, and a definition of a model man. In the ordering of human existence, it assumes a normative posture, which authorizes it not only to distribute advice as to healthy life, but also to dictate the standards for physical and moral relations of the individual and of the society in which he lives. These italics are by Foucault himself. So medicine defines, medicine categorizes, medicine sets a normative order like who is a healthy man, who is unhealthy man, who is a sick man, who is a model man. So medicine will introduce a fit body, and those who are not fitting in the criteria of fit body are seen as a sick person, sick man. And so the idea of normalcy has been produced not just by society, but also by medicine. So medicine has a dual role to treat the disease, to cure the disease, but at the same time to set a normative order, to set a new kind of understanding of human body, healthy man, or a perfect man. So the idea, what Foucault really, makes one aware about is that how medicine functions, what are different roles of medicine, and then how they led to some kind of segregation in the society. The institutionalization of medical knowledge through hospitals, universities became the site of new kind of knowledge production. So hospitals and universities became the site of knowledge production about illness and disease, and medical professionals were trained within the controlled environment. And this training in the controlled environment has led to the dissociation from the social and cultural aspect of health and illness. The controlled production of medical knowledge, the controlled environment of medical training has created and reinforced dominant medical paradigms, where there is like no space for non-Western medical practices or alternative medical practices. Rather, we have only one centralized authority of scientific medicine. When we think about like these changes in the medicine, one has to think about the issue of consent. Autonomy gained prominence, and like the critique which Foucault provides, it has led to the consideration of the issue of consent, issue of autonomy. With like modern times, the rights of patients have been accepted by a medical authority because of multiple movements, but still they are very minimal. Foucault has critiqued the Foucault's critique influenced bioethical debates, and it has reshaped how to think about body, how to think about treating illness. But they need further examination, further consideration, further evaluation, and there is a need for more inclusive, empathetic practices which has to be recognized. So to conclude, we find that we have new understanding of health, illness, and power, where they are not just exclusive, but they are intertwined, and it acts over the other. In this lecture, what we have found that there is no neutral medical knowledge. Rather, medical knowledge has certain kind of power relations, which helps in categorization of the body, which helps in the regulation of the body, regulation of the people, of the community through the state. So it legitimizes, it controls. Further, it contributes and promotes ongoing critique and reflections in the medical field, and calls attention to the ethical aspects in medical practices. Thank you.